Hi, I'm Dr. Satish Kumar from Kaizen Dental. Our aim here is to help dentists succeed. Today we have with us Dr. Alok Sagar, who's going to tell us about doing medical informatics in the US. After completing his BDS in India, he went on to do his master's in medical informatics. He is currently a researcher at the Center for Oral and Systemic Health at Marshfield Clinic Health System. He has numerous publications in various accredited journals. He has also presented his research across various international conferences. He has authored and co authored chapters on medical and dental integration and dental public health. Hi, Dr. Alok Sagar. Thank you for giving your time and joining us.
Yeah,
I have
Alok
seen your
Sagar.
journey. It is extremely unique, where everyone else who thinks to go to US in a non-clinical option thinks about MPH, MHA, and so forth. You
Mhm.
went on and did medical informatics. I would like to know the reason behind this. Why did you take the different route?
Sure, Dr. Satish. So, firstly, thank you for having me. And yeah, I also was among all those individuals who do take that common route, the MPH MHA route. I did come to US with an MHA admission to my university. But when I was attending MHA classes, basically when I went down to attend one of the classes, I realized one thing is like when you want to get into managerial position, leadership positions in those fields, it's difficult because there are enough people already around. And then for me, it felt like it would not be an easy journey, first of all. And then uh, it was not exciting, like like I did not think I would contribute much being in that area. So for me, it was the first cut understood in the first class or second class. I think when I was attending an MHA class, I firstly understood, okay, you have to have a kind of hold if somebody have to listen to you. I mean, imagine you are in a meeting, in a team meeting, and they talk about the what was the game yesterday. You can't because you're not from here. It takes a bit of time for you to understand that culturally, in terms of language, in terms of dialect, in terms of accent. So you cannot have a command over somebody. And this MHA is MHA will definitely lead you to a position where you have to lead a team, especially. So for me, it was like I think maybe it would not it's not going to be a good career option. MPH, I cannot talk about it because I was not in there, but MHA, yes, definitely I felt like no, it's not a good move. Then because all my roommates were computer science graduates, I happened to just sit in one of the classes. This was like a thing, like okay, he was like a just come down and sit in our classes. I just was sitting in a software programming class. I realized, okay, something exciting is there. I think this is something which I want to try. And then medical informatics was the first. I was the first batch in my college. It started with us basically, and it was very new. If you remember, at that point of time in
Yes.
14 15, it was just introduced. So then I went around. I asked like I would want to transfer the course, and I would want to transfer whatever I studied, some credits from MHA to informatics. And they gave me prerequisites. Like they asked me like, oh, what was your math background? It requires a kind of programming skills, a bit of math. So I took those prerequisite courses, and then what I realized is it is a new path. Nobody have taken it, and I thought there are a lot more options I can explore. Still, I was blinded. It was like a shooting an arrow in the dark. But still, there is a path down there because MHA I did not significantly see it. I knew MHA I couldn't do much in career. It's a good option. I'm not saying it's not a bad option. For me, I did not feel I would contribute much. So for
Understood.
that, I was like, I went to informatics, and then things went good, and I'm
The
here.
best thing is you listen to your gut. You
Yeah,
understand at
that
the
is
start
very
what suits
important.
you and what does not suit you, and you
That
just
yeah,
stuck to it.
that is very very important. I think it's very important. I would say anybody coming down to US, I would always say if you really want to do something, take an informed decision. That is the most important thing. Spend your time, like I would say 6 months of your time just to research. The research should be in a stepwise fashion. First thing, go to there's a website called indeed.com in US where you get find jobs. Go there and see with your degree how many jobs are available, what kind of roles are there. Go to LinkedIn and see what those roles would be and what kind of skill sets are they really looking for. And just think like, okay, मैं ये कर सकता हूँ क्या? Can I really do it? And when they talk about like, you have to plan and allocate resources for a whole medical company or a hospital. And just think about it, like being in a country which is not from my culture, how would I lead a team? How hard it is, how easy it is. And it will take time. And now I can be in a leadership position because I've been lived here for long enough. I've been living here, so now it's okay. But initially you have to think about these things. So I always tell people, when you come down here, go to LinkedIn, see what kind of roles people who already has those degrees are currently in. What are they doing currently? And also go to Indeed.com, see how many jobs you have. Like, we have number of hits. If you type in your degree and you say and jobs, you just get number of hits. And you see how many number of hits you're getting with those kind of degrees. Are they really valuable? So it's not just don't come in. Like, I think there was a time in dentistry back home when everybody was like, BDS karo, MPH, MHL, lo, ja America. I felt like there was a whole stream of people who came down like that. But fortunately, I really listened to my gut, as you said, and things worked out.
Understood. Now, but if someone decides that he wants to get into medical informatics, okay, the
Mhm.
path you took,
Mhm.
how many universities are providing it, and how does he end up finding the top universities to apply, and what is the application process? Before you listen to the answer to that question, if you're liking our content, please do not forget to hit the like button below, because the guests out here take out time from their busy schedule to come and give you advice about how to go about your career.
So, firstly, as same path as MPH, MHA, you have to have write your GREs and TOEFLs. So, a good GRE score and a good TOEFL score would be a key. And also universities right now, there are many universities right now that are providing it. And if you talk about top, I would always advise students, especially dentists who are coming down for this course, choose Ivy Leagues first. There's a list of universities called Ivy Leagues. Don't worry about the cost, because if you go to such universities, you would find somehow, some or the other way, you would find scholarships there. For example, for me, I 60 or 70% of my fees was paid off because I was a graduate research assistant in my college. I got a GRA position. I never paid my fees. Maybe I paid like 34% of my fees maximum. That's all. They covered my fees. They gave me a stipend too. So because you have positions called GRAs, and these positions are available in Ivy League universities because they have a lot of funding, and also in public universities. So always target Ivy Leagues, first option. If you think you cannot go there, then target public universities. These are the two options. I would not encourage anyone to go to private colleges, because the exposure is not as good as what you get in these two colleges, because these two class of universities, they have a lot of funding, and
Understood.
and there should be some research exposure. I mean, you need professors working on a part research project apart from just teaching you.
Understood. Just the degree does not matter. Having experience simultaneously is very important.
Yeah, it just that it will not take in. I mean, I'm sure you have interviewed like a lot of people. You're more experienced than me, I'm
No,
sure,
no.
here. But the thing, degree in America, it's like here in this country, skill is what matters. Especially right now in US, what is happening is they don't care what you have. In interviews, they all only ask about, okay, can you do this job for us in a very effective manner? That's all. That is the
Understood.
first step. So yes, the good thing for them even to look at your resume, you should be from a good college, but that doesn't land you in the job. You should also have some skill. But by saying that, I would say start off in a good college, target Ivy Leagues, and you Google Ivy Leagues, you'll get a set of 20 universities or something, and many of them do offer. For example, Penn State University is an Ivy League. Uh, Indiana State University is one of the Ivy Leagues. California, most of the universities in California, University of California, Davis, and University of California, all the campuses, University of California campuses, they're mostly Ivy Leagues. So I would say target them first, and then target public universities. Then look for the private as the last option.
Understood.
Yeah.
Now, what is the expected cost in this entire during this 2 years? How many years is the course for?
Mhm.
And what will you study during this medical informatics? What do you learn basically?
So the cost, the duration would be typically almost 18 to 24 months, and it's a 30 credit course, typically 30 to 33 credits basically. So that's so one credit is three credits equal to one subject technically. So
Okay.
you need, so basically it's like that. So 30 to 33 credits of the course, and it's 18 to 24 months. You start with basically first you will understand the US healthcare system. That's the first thing they will teach you in first year. US healthcare system is one of the subjects. Next they will teach you about healthcare databases, like what is healthcare data look like. So back home, we don't really understand the value of documenting a patient visit. It's so valuable information. People pay millions to just get those health information here. So they make you understand what is health vocabulary in terms of data, and what is healthcare databases, what kind of information is structured, what is not structured, and what are different kind of languages. So when one hospital talks to another hospital, they use a system called HL7. There's a health language 7. So hospitals, when you send the data of patient to one hospital to another, you just don't email it. There's a particular format you use to put the patient's name, like address, comorbidities, has his illness and everything. So that is called, a language is called HL7. So to teach about these, I'm just an example I'm giving.
Understood.
So to teach about all these things in starting with. But this course is just that it will give you a basic idea, just like what is it. But it will never tell you, like, it will not be a master. I'm telling you that very straight. Your masters will not make you a master of your job. It will make you understand basic thing. Okay, this is how it works in US. This is the need of the hour, and this is the skills I need to still gain. That is the thing. And people who come for masters, I would always tell them, apart from doing your masters, also learn technical skills, because in your masters they will not teach you technical skills.
What
It's
are these
not like
technical skills?
you have to learn, I would say, in terms of programming, learn SAS, SQL minimum. I would say you should know one data analytics language where you can, and you should know one programming language, nice one. So I think Python is a need of hour. Everybody who learns Python definitely has a career. I feel like that. So learn Python before you apply to those courses in India. 6 months, take a break. It's not a rocket science. Anybody can learn it. So learn basics of Python, basics of SAS. SAS is a statistical analysis software. Learn basic biostatistics, which you can apply in terms of epidemiological perspective, like dental public health. If you want to do any projects in medical public health or dental public health, minimum statistics you learn before you come. Minimum coding. That's all you need, and then you would be a lot confident in most of your class.
Understood.
And
So it'll give you skills also to get a job later on.
definitely, programming skills are very important, I would say. Like SAS, SQL, you need to at least know them. And if you say SQL, that's everything is in YouTube videos. It's self-taught. You can just sit back. There are like websites with 150, 160 videos. Sit back every day, 1 hour, 3 months, you're done. You're finished. You don't have to master it. You don't have to master it. You just have to know it, understand it. Because when somebody is saying something, because your expertise is not programming. When you take medical informatics, you are a domain expert in both ways. So you're an informatician and you're a dentist or a medical professional. So you combine these two and you come in as a very valuable guy or girl, like somebody who's an asset to a company. But you have to have technical skills because you have a team below you who is coding, and then you have to give them instructions. You are like somebody who's like there's a term I'm not remembering it, like a middleman, I should say. It's not a middleman, but between two stakeholders, you're the one who's building up. I mean, you're making informatician understand the needs of a physician or a dentist. So you're like that. So dentist comes and says, hey, you know what? I want to see the comorbidities of all the patients on my dental record. He tells you. Informatician doesn't understand what the hell is that. Now you sit back and explain him that this is the wireframe. This is the EDR. When a dentist clicks on this patient, I should see a drop down with all his comorbidities list. And this is what I need. So you don't need programming skills to do this. You're just here to understand the needs. So that is where you come in very strong, basically. So your domain knowledge of dentistry or medicine always helps you a lot in this. So that is the
Understood.
most valuable asset, actually.
So this medical informatics comes in STEM or is it a non-STEM course?
It is a STEM course,
It's a
and you
STEM
do have
course.
it's a STEM course. You get 3 years of OPT.
Okay, so after your degree, 3 years, you can stay in the US and find a job and work in it
Yes,
without a company giving a sponsorship to you.
sponsorship. Yes, but there is a small glitch to it. I mean, first year you can still, first year of OPT, you find a job, don't find a job, nobody. It doesn't matter for US government, actually. But from second year OPT, you have to have a job. 40
Okay,
hours. Yeah. So it's like, I mean, it's an information, I think general information, everybody knows it. So it's a STEM course, but you don't need sponsorship, but you need a job.
understood.
And you will find it. It's with this thing, you would definitely find a job.
Yes, but my question is, after those 3 years are complete, how is
Mhm.
the job opportunities out there? And
Yes.
is it easy to find a job? If it is difficult, what they can do different so that they have a job?
Yeah. So to answer this, as I said previously, technical skills. So if somebody comes in, they have a medical informatics masters, they come out, and now when you see medical informatics masters, they are looking for Okay, do you know SAS? Do you know SQL? Can you code? So if you don't have these technical skills and you come out and you say, I need a job, you will not land up in a job. So the best way to do is when you're doing your master's in medical informatics, learn technical skills. Learn Python, code every day. For me, it was like I hired somebody from India every day to give me coaching for 1 hour.
Wow.
Yeah, because it was cheaper. You just pay nice, some money, and then every evening it's one-on-one class. You can ask all the questions. He's to teach me nicely. So 2 years every day I did that. So you learn technical skills. Then you are a valuable asset. You really are valuable, and they do sponsor H1s
Okay.
for medical informatics masters. They do sponsors. You end up basically in insurance companies if you are a good data guy, or you end up in pharma companies. As so, if you know SAS, you end up in something roles called as clinical SAS manager or clinical data manager or clinical SAS programmer. These are the things we end up in pharma companies where you work on their clinical trial data using
Okay.
SAS. If
So
you know
these jobs
SQL,
are mainly in private, or they are even in government jobs are available as
you
in
cannot
university
get.
based.
Yeah, you do have university-based jobs. You do have. So they're in the fields. If I say they're in insurance, they're in pharma, they are in hospitals. In hospitals, you end up being an analyst, or if you end up in a research place, then you are a research analyst. And if you still want to, if you have more technical skills, like if you're really sound technically, there are positions called as health data scientist. So in most of medical schools here have a position called as health data scientist. And that for that, you have to be technically absolutely skilled. And because you're technically skilled and also have a domain expertise of medical background, a domain in that you have a domain expertise being a dentist or a physician, you're valuable like that. So these are the jobs you end up basically.
Understood. So if someone is planning to take the route you have taken,
Mhm.
what would be your advice to them? Because you have seen it, you have guided a few
Yeah.
people. What do you feel people lack, or what they need to improve on, and what they need to keep in mind when they're getting into this course?
First thing first, don't think like somebody got a job, I'll get a job. This may be discouraging, but absolutely necessary because you don't know what skills he has and you don't know what scenarios he went to. So because I've seen people like, oh, one person takes a optional in USA masters. You see lot of juniors and everybody following those people like that. It's not like that. So I always say like, I would, if you can't sit and code, if you're allergic to coding and you come and take medical informatics, what would you do with that? I mean, I would say, no, there are some courses in India called Edureka courses. I always tell
Yes.
people who ask me, I was like, if there was a dentist, like a junior of mine who was like, sir, I wanted to do biostats. I was like, okay, you know what is biostats? He's like, yeah, statistics करना है, community में मैंने पढ़ा है. मैंने बोला, I was like, go to Edureka, see videos of the complete course, and then think about, can you do this your whole life? Can you do those calculations? Can you do those statistics? Can you do that kind of math? Because if you're a biostatistician, because all she saw is biostatistician makes a nice money, and she thought MS in biostatistics is good for her. I think that is absolutely good, but can you do that? Because biostatistics is a grinding course. You really need to be there and really have that kind of interest. So I would always tell people, if you want to come to any course, biostatistics course or a medical informatics or anything like which is skill based, go see some videos like educational videos. Go to Edureka, see what is Python programming, basic Python programming, what is SAS. Go to people who are doing SAS and see, can you do this coding? Download the free version of the software and just try to write something and see how irritating is it. Is it irritating, or are you really like excited to do that? If you're seeing the other side of it, like, oh my god, I'm learning something new, this is really exciting, then yes, definitely this is for you, because you will learn it eventually. You'll put some energy to learn it. So I always advise, one advice is like, take an informed decision, do research, because I'm sure you're spending, I think medical informatics would cost in basic, if I should give a spectrum of the amount, it will be like 20 to 25 lakhs. That's the amount you spend. I mean, it's a good amount of money. So I'm sure you need research, 6 months of time, and then don't just come in like that, because after your masters, there is a lot more skill you have to acquire. If you're not comfortable with that, it will be very difficult to survive. And I've seen people going back. I have seen people not comfortable with coding and they start trying to do something else with this degree. Because once you're an informatician, you're an informatician. You cannot do anything else. You have to do it. Then you have to be very comfortable with that. I mean, I'm coming in hard. I know, like, you should not coming
No,
in
it is
hard, but
absolutely right, because we do not
because
want here to give any false sense of hope to students.
yeah,
It
because
is
I
for
have
helping them.
helping them, because I've seen students like struggling, like they call, because I in my department I can do internships. Like I could give, we do select interns. Like for 3 months, they come down and they work on a project of mine. It's a paid internship. Every time we do it. So most of the time I select BDS people from India. We do it because we are the same. We call them, we give them an idea. It's a paid position. And I have seen people like literally telling me in an interview, like I've seen, I don't want to exaggerate it, but she wrote a bunch of languages, of technical languages, like she knows Java, JavaScript, she knows SAS, SQL, Python. The director was sitting next to me. He was like, I think she should be the director, not me. She knows so much. And then when we called her, she doesn't know a speck of it. And I said, internship you can pass through, but trust me, learn at least one language perfectly. One, learn SQL or SAS, because without these you cannot be valued outside, because you have an informatics degree. You cannot just survive. It's not gonna be that thing. So I always tell them, if you're ready to acquire a new skill, excited about it, then come down. Don't come with an idea that I'll do informatics, I'll write DDS. If I don't get DDS, then I'll fall back on this. Don't come with that. If you really try writing DDS, but also try to be serious with your masters, just don't make it a backup, because courses like biostatistics, courses like informatics, courses like biochemistry, these are not backup because these are skill-based courses. You cannot make DDS as your backup, right? It's a
So
skill-based
just the
course.
degree will not help you.
Not at all.
So you have to
Not at all.
focus when you're studying, and you have to see you get the skills along with it. Only then you
Technical.
will be valuable to a
Only
company.
then, definitely. Technical skills. You have to be technically as sound as possible. The more technically sound you are, the easier the job you'll find the job easier here. So that's
Understood.
the thing. Thank
Understood. It was really amazing to have you, Dr. Alok. And the
you.
best thing about you is you didn't want to make it very rosy. You laid it
Yeah,
out down there that there are jobs, but if you're willing to step up to it. It was very
definitely.
nice interviewing you. Thank you for your time, Doctor.
Thank you. Thank you. It was nice talking to you.
If you're thinking about doing Masters in Public Health in the US, do not forget to go and check our video on that.